the truth.
I'm kidding.
So in this group, I guess we feel kind of safe, you know, because we all are LGBT or have LGBT issues. So sometimes another oppression like age, we can just kind of flip that off. But I want you to kind of feel what it felt like when I first said, I want you to say your name and your age. Because we're working with elders, older adults, and they kind of wear it. When I'm talking about seniors, they wear their age on their bodies. They wear it. So they can't pass for 45 or pass for 32 or whatever the age is that you have. We know they are seniors, and so there's something in our brain that tells us, well, this person is a senior. It's unconscious because we're a youth-oriented society. So it's unconscious what we think. It's unconscious that we think maybe a senior can't learn something new. It's unconscious that we think that a senior or older person, I'm trying not to say the word senior, it's not, older adults is supposed to be the word of choice now. It's unconscious that we think that an older adult moves slowly, thinks more slowly. His or her cognitive abilities are slower. But that's not necessarily true. And it's not going to be true for me. When I'm 80, I'm going to be driving, doing everything. So just so you know. So thank you very much for participating in that exercise. One of the things that I didn't say is that ageism, when we talk about older adults, that's just one stigma. But if you add being lesbian, being gay, being transgendered, being a person of color, being differently abled, and multiple other oppressions can appear externally and internally, and it can indeed affect our health. So, some general experiences LGBT elders that contribute to the health issues are, there's a sense of being different. Folks have an aversion to labels, like somebody mentioned geezer, old geezer today, or dinosaur. You know, nobody wants to be referred to with those kinds of things. But when we think older people, sometimes those ugly names can come out in our consciousness. I recently did a study with lesbians and gay males of African descent as participants, and all the participants experienced a sense of alienation in the African American community, and they experienced detachment sometimes in the mainstream community. And it was described consistently as it is a hurt that lasts a long time. So can you imagine being a member of a community, the LGBT community, and you're not accepted for one reason or another, one reason being that you're getting older, or being in the African American community or people of color community, and you're not accepted because you're LGBT. It puts you in a hard place. More than half of the participants had been called names, whispered about, or harassed. And so it was not surprising that a majority of the participants were not out to many members of their family, at work or at church or to their neighbors. Many of these people said that they passed. You remember, I know some of you may remember stories of African Americans way back in the day, way back, who were able to pass as white, and they would because life would be simpler. Well, life can be simpler if you don't say that you're LGBT, especially when you are now a vulnerable older adult. I just heard a story today from a clinician friend who stated that she had bumped into someone who tried to ignore her, and they used to run together in their 20s and 30s, and this woman was really out, was a big butch lesbian, and now she's a minister. She says, I don't do that anymore. And in my research, I found that a lot of people went back to their old churches, went back to their old lives, because it seemed simpler to be that person, that, quote, heterosexual person, or look like a heterosexual person, as opposed to being a person who loves men or women. And that's a sad place to be. So We know that older lesbian women and gay men can face constant stigma and systemic bigotry based on their age, their sexual identity, their sexual orientation, and that can create challenges. Many of those who are in the silent generation do not have children and have lost many of their logical family and friends to the AIDS, HIV epidemic. There's a gentleman that I know who told me that he lost all of his friends. He lost over 100 people that were close to him during this epidemic. Now he doesn't know who will take care of him or who will be with him. And he started crying. Who will be there for him? So these people in this generation have lost a lot, including their friends. And they have no one to take care of them. 2 minutes? 1 minute? Okay. And so Joe just told me that I have 1 minute, so I'll say this pretty fast. So there are barriers to participation in the mainstream environments, including assumed heterosexuality. There's a lack of respect for one's personhood, fear of being harassed and discriminated against by staff, fear of being outed. Lots of these people have never come out. Fear of and the lack of LGBT and African American cultural sensitivity markers in the physical environment. So the recommendations are, and I think the recommendations are to eliminate, oh God, I lost my place. Aging community and social services should create environments that are visibly welcoming and inclusive, and programs that specifically address the needs of lesbian and gay folks, lesbian and gay elders. When you go into your place of business, there should be a place that people know if they're gay, that they're welcome. If they're of color, there should be something that lets them know that they're welcome. Thank you.
Thank you, Imani.